All right, good evening, everyone. This is Dr. Schillng from Secoya Health, bringing you this week's Wednesday Wellness Minutes. And just a quick plug here before we get started for our Participant Appreciation Week, which is this week. And 2 days from now is our Participant Appreciation Day, where we're going to have an event from 1 to 6 here at the clinic. We'll be having vendors providing samples of things and opportunities to talk to people like biological dentists, and raw bar is going to be here and things like that. Tons of opportunities for you to enter into drawings and things like that for Anissa's fabulous baskets. And we're also going to have drawings for kids, a lot of activities. I'll be hanging around. We're going to have catered food from 4 to 6. So that's Friday the 20th, in 2 days from now. So we certainly hope you can join us. We entitled this A Peek Inside of Check with Me because Amelia's got some stuff going on, and we like to do the watch me do style. So you get kind of a glimpse on what we're doing and how it works and stuff like that. We certainly won't do a complete full workup, but we want to give you kind of a glimpse. So I'll first off start off by having Amelia kind of give you just a brief snippet. She's not going to go too in depth, but a brief snippet of what she's dealing with so you can kind of understand her symptoms and how I'm going to go about, well, you'll find out how I go about finding what's going on with her.
I've been feeling I'm feeling really emotional lately, to be honest, and I feel a lot of tension in my upper shoulders and in my mid-back, majority of it, which is probably emotional based.
Okay, so mid-back.
Yeah.
So mid-back, touch my back where you feel it.
Right there.
Okay, right here.
My diaphragm.
Okay, yeah. So your ribs come up here, and your diaphragm is on the front, but it attaches to your T12 vertebrae right here. And you've seen, I think we just posted something recently, a replay of a previous one where we talked about tension in the diaphragm causing acid reflux and indigestion, things like that. It's a very common problem. Think of your diaphragm as sort of a glass ceiling for your stress in life. You just hold it down. So we tighten up and nothing flows up and down, okay? So it just kind of holds it down. So pain across the shoulders and in the mid-back, right? Mm-hmm. Okay, have you changed anything about how you've been eating or drinking?
I've been trying to eat, I have a tendency to eat more at night, so I've been trying to kind of shift my eating window, do a little bit more of intermittent fasting type thing, and so more in the morning and like before like 6.
Okay.
And so I've been shifting things a little bit that way.
Have your foods changed at all?
Better.
Better. Okay. How about consumption of any beverages or any ice creams, drinks, anything like that?
No, not as much. So I've been drinking a lot more water. So I got my big gulp now. And I carry like a 32-ounce bottle of water with me everywhere. And so drinking more water, making sure I'm getting the proper hydration.
Okay.
Yeah.
All right. Any other symptoms like changes in nighttime, bathroom breaks, headaches, fatigue, anything like that?
Nope.
Okay. And when was it before this recent onset of like shoulder discomfort and mid-back? How recent prior to that had you experienced something similar? Or is it something that goes ongoing all the time?
It's something that comes and goes a lot.
Okay.
And so I think it's based on like my stress load. So now that I am a little bit less stressed and my mind isn't as focused as much as like all my schoolwork, since I have a break right now, I think it's all kind of hitting me at once.
Okay.
Yes.
So this is a common challenge for a lot of people. When the chatter of life calms down and we actually have a sense of what's going on in our body, it can be a little unnerving, okay? We just had a consult with a young lady, probably in her 60s, maybe even early 70s. She said, I'm great during the day, but as soon as I get home, I start eating. Because she feels this anxiousness inside, and that's what helps calm her down, just as an example. So we all have different triggers, we all have different stresses. Have you had any discomfort moving your neck around, anything like that?
Not too much. I feel it a lot when my head's back.
Okay. Does it feel like it's jamming?
Yeah, it feels like everything just like gets really tight.
Okay.
Yeah.
This is kind of funny because we did the get to the root cause of headaches in the past, and I think we did something similar with you.
Yep.
Have you had any headaches lately?
No.
Okay. Fabulous. There you go. So let's just test your neck muscles. Let's tip your head to the side. I want you to hold down and don't let me push. Good, and hold, and then tip to the other side. So we're just checking the integrity of her neck to see if there's anything there. Tip back. I want you to hold there. Don't let me push. And what you'll notice is that doesn't work very well. Okay? Okay? I'm messing up her hat. She doesn't like that. All right, I'm just kidding. Tip your head down. Don't let me push. Okay, and then hold down again. And what you notice there is, so what we have is some over-tight neck flexors on the front and some weak ones on the back. And what's most likely the problem is, you have this beautiful mane, the muscles on the front here are shutting down the ones in the back. There's something called reciprocal inhibition, or just basically thinking of one muscle that's the opposite of one, shutting it down. So this is getting yanked down, it's shutting down this back here. So she's not really weak here, it's just over tight here. Okay? Now there's some consistent patterns for anybody who has pain across the shoulders. We joke that the Minnesota point is the gallbladder, right? But if you know anything about physiology, the gallbladder receives all its contents from the liver. So you can, unless it's passive aggressiveness and you're just stuffing all your anger, frustration, resentment, disappointments in your gallbladder, it could be that you have toxins coming out of your body, like she's eating better, drinking more water, she's flushing toxins. It could mean that her liver's dumping more stuff out than she can handle right now. Okay? So a gallbladder flush would be really helpful for you to decrease that. So let's just go with reflex points. I don't have a chart in here per se. Can you look up there? Just one of the many charts. Got it? Okay. So if there's no glare on there, hopefully, there's a bunch of points on here. And so we use reflex points on the outside of the body because they reflect what's going on the inside of the body. As a result, we can stimulate different points on the outside, and it can change things on the inside. It's kind of like a math problem. You get 2x plus y equals, we don't know. We're trying to figure out that x factor to figure out what's the variable. In this case, I want to know what's tightening up her neck flexors, right? So we can actually... No. That's not over there.
Oh, yeah.
There you go. It's over there. What you want to think of is if the front's over tight, it wouldn't be an easy thing to see. But if we can address what's causing the excess tension in the front, it should, if we can eliminate that by checking your reflex, it'll affect the back. Okay? Because it's easier to see rather than doing the test for the front. So find your belly button, and then right below it, put 2 fingers and hold that pressure. Now relax your right hand and tip your head back. And hold that there. And what you notice is, now she's super strong. Yeah. Okay? I didn't expect that. I was actually going to assume that wasn't going to work. Let's go over to the spleen point. Okay? Tip your head back. And you're going to hold there. All right. Now that doesn't work very well. Okay? So we're going to go to a lung point. Right up there. Tip your head back. And hold there. And okay, I'm not going to put her through too much of this. Let's just go down here to her liver, reflex point, right on there. And tip your head back. And hold there. Okay, great. So that, now relax. Now I as a clinician have to figure out which one of those is primary, right? We had 2 reflex points that were positive because both of them improved the strength of her neck. Now I'm thinking to myself, you put food in your mouth, it goes down your stomach. Stomach then dumps into your small intestine. Your liver also dumps all its garbage into the small intestine. So if the small intestine's upset and the liver's upset, who's upstream? Right? So the liver's the problem most likely versus the small intestine. That's my first assumption based on what her body's telling me. And again, the cool thing about kinesiology is that there's no book I can read, there's no class I can take that's ever going to tell me about her body better than her body can tell me. So why not use what knows the best and go from there? So that's an example of how we can decrease stress, like support her body. So all these things over here, it just depends. It could be a biochemical need, it could be a viral or bacterial or parasitic stress in her body, because we all carry this kind of stuff. So it just depends. We could take something, and what the gold standard for any kinesiologic test is called oral nutrient testing. So we would actually pour stuff on her tongue. But as a second best, I'm not going to do that, just relax. She's getting a little excited over here. So what we'd want to do is, so that's one option. So what we can do, as just an example, let's have her, so when you smell something, it goes into your olfactory. But if you've ever had someone say that something smells really bad or it tastes really bad or that tastes like garbage and they've only smelled it or whatever, it's because most of the time actually every time, it goes in your nose and it actually ends up on your tongue, okay? Because it goes into your nasopharynx and it kind of whirls around in your mouth and ends up on your taste buds. Mm-hmm. So not only do you smell it, but you literally taste anything that comes in your nose, okay? Because it's not limited to that. So a couple of options. I'm looking at liver support. So I'm looking for a differential diagnosis, right? What's going to help her? So we have something like hepatavin or premier taurine, okay? So what we can do is, like I said, the gold standard would be to take this capsule, twist it open, and pour it on her tongue. But she's not really into that, so you can smell it, okay? And then we can hold it just in your hand, and then bring it toward your body and hold it over the reflex point. You don't have to do it necessarily on the body. You tip your head back, and then you're going to push, and that does nothing. Okay, it's not changing anything, and she's having fun with her neck here. She's like, oh God, don't worry, I'll fix it later. So then what you can do, again, this is just a surrogate for when you do it on the tongue. So then you smell that. So that's taurine, which is a fantastic amino acid. Put that in your hand, put it against your body, and tip your head back, and you're going to hold there. And right now, okay, and it doesn't hurt her, and she's strong. She's Superwoman again. She's Wonder Woman, whatever you want to call it. Okay, that's just an example of how you can do differential diagnosis, and you can understand how the body works. Now, as far as the shoulders go, across the shoulders, the points up here on the top is called gallbladder 21. So if you ever go into acupuncture or Chinese medicine, these are symptoms, right? All this tension in her shoulder is a symptom because she hasn't, fallen off her bike, been hit by a car, been in a car accident. So there shouldn't be any tension in her body. She should be like, hey, I'm like Gumby, I feel good. But what she's dealing with is a bunch of tension, right? So when there's dysfunction in the liver, it'll affect the gallbladder inextricably. It always does that. And as a result, it can show up in different tissues, right? So it just depends on what she's dealing with. Now, as far as the tension back here, right, we can try something. So cross your arms, hands on your shoulders, and let's see, arch your back, and don't let me push you back, forward. Push back. Okay, that works fine. Push back again. Good. So now I'm going to have you tip to the right and push down. Okay, now I'm going to have you turn to the right and hold there, and don't let me turn you. And what you notice is that doesn't work so well. Now, a lot of things can shut that off. So I'm going to just do something. I'm going to say, turn this way. I'm going to have you take a deep breath in and hold it. And hold this here. Okay? Okay? Now she's strong. Okay? Now, yeah, she's like, relax. So that's just a quick way to say, okay, I'm wondering, as the physician, is her diaphragm tight and affecting her midsection, limiting her from actually functioning better? And that was a yes, in case you didn't get that. We can see what else is. Cross your arms again. Turn to the left and hold there. Don't let me turn you. And this side works just fine. Okay? All right. Okay, curl down. Do like a crunch. And don't let me uncurl you. And hold again. Okay, that's fine. Great. Okay, so this is just how we go about differentially diagnosing. We got to understand what the problem is. Because in the absence of trauma, the body breaks down on the inside before the outside. She has external symptoms, but yet she has not been hit or injured or traumatized in some way, shape, or form. So therefore, your mind has to say, if I haven't been injured, it must be coming from the inside. Then you need a detective, if you're not one, to find out what's going on. This is kind of a glimpse as far as what's going on. Do you have any discomfort on one side versus another?
It's tighter on this side.
Tighter on that side, okay.
Yeah.
So, we always talk about fun things like where stress is in life. So we talk about right side of the body in Chinese medicine and in Indian medicine is the masculine side and the left side is feminine. So there could be some type of conflict in her life relating to neuroemotional stress from a female in her life. We don't need to elaborate on that, but it's possible. If we're on the right side, it could be a male in her life. It just depends. Okay, so this is just and then you can figure out based on the tissue, if she had ringing in her ears, if she had pain in her low back, shoulders, or like inability to get out of the way of someone, inability to avoid someone, things like that. Bearing too much responsibility. If you feel like you're bearing too much responsibility in a relationship, that's an example. Torso, like through here, is inability to break through, inability to get through, inability to overcome, things like that. So there's always a story behind a symptom in the absence of a trauma. If there's a trauma, well, it's pretty straightforward. Yeah, I got hit by a car, or I fell off my bike. But in this case, there's some stress going on the inside. There's also stress on the outside, and we can figure out the difference between that. Is there anything else that you've felt flare up since we started challenging you?
No.
Okay, gotcha. Let's see. I know I've done a cranial adjustment on you before, right? Mm-hmm. Okay, so I'm just curious because two main things can cause cranial issues. One is that is a trauma to the head. Okay. Another is that there's a massive amount of stress. Now she just had 6 or 8 weeks of classes. 10 weeks, excuse me. Mm-hmm. So she's working almost full time here, so 33 hours, 32 hours, and she's taking classes for 10 weeks, and so she's under the gun, shall we say.
I'm crazy. Just kidding.
I'm crazy. All right. So what I want you to do, we know if you hold your head down nice and strong, it works fine. But if we push and hold, and then you hold again, we know that unlocks, okay? So that tells me the muscles are tight, but is it just the reflex, or is there literally a cranial dysfunction here? And that's off, unfortunately. I was going to show you a picture. So what I want you to do, make sure your feet are touching the ground, so scoot forward, just so you have something to push against. Okay. Now, arms, palms up in your lap. There you go, just nice and relaxed. So I want you to start here, and you're going to slowly drop down like this, okay? And I'm going to catch you somewhere in between, okay? So go ahead. Okay?
Oh.
All right. Now, what you notice there is she went back the opposite direction. So that tells me that she actually needs a cranial adjustment. Now, I don't need to go into the reasoning behind that all. She's excited about it. I don't necessarily know that she's going to consent to doing that on camera, but in essence what happens is she's under enough stress, unless you, of course, you fell and hit your head, you've fallen and hit your head, okay, that her cranial sutures are tight. So, you know, the temporal and the frontal, or temporal and parietal, temporal and so occiput's here, temporal, frontal, parietal, okay? And then right through here is called the sphenoid bone, which actually touches every one of these bones. So by using the roof of the mouth as an access point, we can actually mold and shape the skull back to where it's supposed to be, okay? So here's a quick differential diagnosis. So now, this time when you pull your head down, I want you to put your tongue on the roof of your mouth. Okay, just push up, firm pressure on the roof of your mouth. Okay, now pull forward, pull, drop your chin down. Okay, now what you notice there is that gave me an indication that by releasing the tension in the skull, that's going to allow her muscles and her neurology to return back to normal function. Now this is not something I normally do, but it just occurred to me like, oh, it's something I can easily show you. But these are things that other physicians, other doctors out there that can use as far as figuring these things out. And also you can help. The cool thing about this is that she's involved, right? I'm not just dictating to her like, oh, Amelia, you've got problems here and this, and it's related to that and other things. We can dive into her story and understand what's going on and then show her and feel the difference, like when it's on, when it's off, and then you're involved rather than just saying, you know, all right, Amelia, why don't you lay down here and I'm going to crack your back a couple times, I'm going to lay on your side and whip you a couple times and then adjust your neck a couple times, okay? It's very effective at decreasing pain and increasing some mobility and things like that, but over the long term, we'd rather do 3 things than 30 things, if that makes sense. So that's why we do it the way we do, because her brain sends signals down her nerves, which control her muscles. Her muscles then hold her joints in certain positions. If I, as a chiropractor, try to adjust her joints and put them in a certain position and expect them to stay there, I'm now assuming that I know better than the body why the joint was in that position in the first place. So what I can do is I can help guide her brain and her body and reconnect the different parts, right? And then release the stress, which will then turn into a long-term, more profound effect that lasts than, you know, needing to re-educate her body in another 2 days or 3 days. Does that make sense? So that's just kind of an example of quick peek on the inside of a checkup, right? A lot of people hear about what we do and they kind of get an understanding, but it's certainly not something they've never experienced before. So we do these things in order to help you understand how they're intertwined and how all of your life story, whether it be what you eat, what you drink, how you're sleeping, the people in your life, how you're pooping, how you're drinking, all of it, right? It all depends, and it all has a play. It all makes a difference in her life. So reducing stress is always the goal. We don't want to manage stress. Who's got time to manage stress, right? Nobody. We want to get rid of it. So if we can take those proverbial grenades or dynamite sticks in her nervous system, whatever those stressors are, whoever they are, and take the fuses off of them by doing QNRT and other things like that, and making her aware of it and saying, well, it's possible that your stress in this part of your body is related to this, and so on and so forth. And then she can say, oh, you know, that makes sense. Or I never thought of it that way. Or she can actually say, well, that doesn't make any sense. And then we have to dig a little deeper. But oftentimes you give people a little bit of information and they just run with it because they understand. They're like, oh, yeah, well, I can tell you right now. It's Bob at work and, you know, he's driving me crazy, right? You know, so you got a little T. Gandhi flared up and somebody's making him crazy and you're not getting what you want in life and whatever it is, right? So there's a story behind every single aspect. But that's just kind of a glimpse into the world of how to differentially diagnose the real root cause of why someone has symptoms. Okay? So I hope this has been beneficial. If you have a condition or something you've been labeled with and you wanted differentially diagnosed or help understanding it, just put in the comments below or send us a PM, private message. Because we don't necessarily want everybody knowing everything. You know, anonymity is important. So if we can allow you to get information from us without anybody else knowing, that's the ideal scenario, because then you can get benefit from it, but other people, I can guarantee you, it's like in class when you're in school. If you have a question, I almost guarantee 3-4 other people have the same question. So what we can do is we can help educate other people and empower them to live their fullest life by using the challenge you're facing, but not, including you in it. Unless, of course, you want to come on in Wednesday, you're more than welcome. I'll work you up right here. You got to sign a waiver. It says I'm okay being on TV, which is like Facebook's TV anymore. But that's what it's about, helping you, help yourself, and helping your families. Okay? So let us know if this has been beneficial. Let us know what you'd like us to present on so that you can feel more connected to your body and have a better understanding of it. And let us know what kind of watch me do video you want us to do so we can present something that's beneficial to you and impact your life and improve it. Okay? So for now, Amelia's going to say goodbye.
Bye.
And we'll see you next week for the Wednesday Wellness Minutes. Bye.